All Sertomans share in a national mission of hearing health. Since 1963, we have made it our goal to improve the quality of life for those at risk or impacted by hearing loss through education and support. As such, it is only natural that our clubs and members have sought and continue to seek out relationships with hearing and speech professionals such as audiologists, speech pathologists, educators, interpreters, and more. In this session, we'll talk about the importance of connecting clubs and speech and hearing health professionals. We'll also share the benefits these relationships can have on the health practitioner, the club, and the public. We'll cover what goes into forming these partnerships and what success might look like. I'll end by sharing a few places where your club can look for potential partners in your very own community. Let's get started. Over 60 years ago, Sertoma's volunteer leaders chose hearing health as its national mission. It was their goal to help the more than 24 million Americans who had speech and hearing disorders at that time. In the decades since, the number of Americans impacted by hearing and speech disorders has risen to over 50 million. The World Health Organization predicts that people living with some degree of hearing loss will rise to 2.5 billion by 2050. Hearing loss is a health crisis with no end in sight. While we may not be able to solve it alone as an organization, we can do things to help others in that fight. That is where you come in. There have been significant changes in the health field over the past few years, especially in the wake of rising healthcare costs and the COVID-19 pandemic. Health professionals and the community agencies charged with providing services to patients have found an increased strain on their resources. More and more individuals are turning to practitioners and social service organizations for free advice, treatment options, virtual care, and financial assistance. Community assistive charities are also finding that the needs of beneficiaries are becoming increasingly more complex. For instance, during the height of the pandemic, when many of the most vulnerable populations were unable to leave their homes, assistive health care became much lengthier and more demanding. While this may not always be something directly applied to hearing health, we should keep in mind that when a need arises in other sectors of the health field, it means less financial, asset, and human resources are available to others. This becomes most obvious in the limited staffing that has plagued healthcare in recent years, as more and more people choose to exit the field for one reason or another, all while the demand for them is rising exponentially. One final thing I want to point out is that traditional social service agencies are charged with the important goal of serving often overlooked populations. As their society has changed and grown, so has their responsibility. All of these things in combination, along with other factors not mentioned here, illustrate why there is such an important need for outside service and charitable organizations like Sertoma. Now that we have this understanding of what has been happening in the healthcare field in recent years, we can already begin to see why partnerships are so critical. With the strain put on the community assistive organizations, there is a growing disconnect between healthcare providers and those patients in need of help. With overly burdened agencies unable to meet the demand and needs of the public, partnerships with organizations like Sertoma can help make all the difference as they tend to positively impact healthcare providers, social agencies, and patients alike. Partnerships have also proven beneficial as mindsets in the industry have changed. Health Affairs, the official journal publication of Academy Health, has termed this as a shift from value to volume, wherein healthcare providers are trying to reduce hospital readmissions and ER visits in favor of outpatient and at-home care. This means that community agencies are being asked to accept more responsibility for these patients, which again increases the need for outside assistance from organizations like ours. Likewise, experts continue to prove over and over again that improving social and economic conditions can positively benefit overall health. This comes in the form of providing things like safe and affordable housing, food security, healthy behavior education, economic security, and more. It can also mean that partners can help identify health concerns connected to the social and physical environment, as well as solutions to overcome these obstacles, explains a blog from Tulane University's School of Public Health and Tropical Medicine. When approaching potential healthcare professionals about a partnership, your club will want to have benefits ready to share with them. While we are examining a few here, these are in no way all of them. Take time to brainstorm what other benefits might be specific to the potential partner, your club, and/or the community the two share. First up, philanthropic opportunities. Most people want to give back, and when paired with their area of healing and expertise, philanthropy becomes even more attractive. These individuals obviously want to help others, or they wouldn't have chosen the field that they did. The partnership gives them the opportunity to potentially provide further assistance to their existing clients, as the patient will likely have access to additional benefits depending on the program you both agree upon. The other two benefits we have here focus on exposure. For brand new providers or new to your area practitioners, getting involved with a service organization like Sertoma can help them become more easily visible and integrated into the community. Reputation is everything, and when they become a positive part of the community fabric where they work, speech and hearing professionals can become trusted solutions to our many healthcare problems. This exposure also provides natural promotional opportunities, including, most importantly, word-of-mouth marketing. Just like when you want to sell potential partners on forming a relationship with your club, you'll also need to get buy-in from your membership. First up, the relationship is going to provide you with beneficiaries upfront, the people in your community who you're trying to help. You may not need to focus as much on seeking them out, as speech and hearing providers are going to have natural patient base who may be able to benefit from your program. These clients can also help you more easily identify the needs that are in your community, enabling your club to expand its work or alter it in order to address something new altogether. It helps you know that the work you're doing is what your community really needs from you. Working with hearing health providers can also provide your club with much needed expert knowledge. They can help you understand the science of it all. They know other practitioners and entities that might be able to also help you with the program. Finally, partnerships can have potential fundraising advantages. When you have a clear case for support, people are more likely to give to your cause. They can see what the program is, that you have a trusted community partner supporting it, and who stands to benefit from these services. You might also be able to piggyback on their name recognition to reach a new class of potential donors. Finally, let's think about the real reason we do what we do, those in need. How can our beneficiaries benefit from our partnerships? The first one is obvious. The more help we have in making our program possible, the better access they will have to services. Second, we have improved education, which we touched on earlier. A great example is our Safe Years program, which uses education and information to teach children and adults about noise-induced hearing loss. The goal is to inform others how they can avoid, change, and/or replace unhealthy behaviors. Finally, we have equitable care, which is closely related to the other two benefits we just mentioned. Tulane explains that by improving resources and educating citizens on healthy lifestyles, public health groups can change the health trajectory for at-risk populations. The types of public health programs organized and supported by organizations like Sertoma have a goal of equitable care for all citizens. After all, it's in our name, service for mankind. We want to provide meaningful change and care for underserved populations. Keep in mind that underserved here can mean nearly anything from inner cities and rural remote areas to those who may be missed due to race, creed, orientation, socioeconomic status, and more. Tulane also includes communities coping with natural disasters, extreme poverty, or disease outbreaks. Now that we have the what and the why covered, it's time to think about the how. I want to start this discussion with two basic understandings. Number one, know that this can be a slow and messy process. It's going to take time and likely won't be as straightforward as we'd all like. This means that it's going to require patience and trust, which leads us into our other understanding. You need to trust the process, trust your club, and trust your partner. You're all in this together, and between busy schedules and red tape, it's just not going to happen overnight. It may also require other stakeholders. You may need additional partners to help make the work possible, whether that comes in the form of local government assistance, other healthcare providers, or partner nonprofit organizations. While this can lengthen and complicate the process even more at times, it can also be greatly worth it in the end, as it may strengthen the program's longevity, viability, and impact. So now, what does the actual process look like? Well, here's one path you might explore. I'm not going to touch on finding the partners here. That is something we'll come back to in a little bit. This starts with these first conversations with your potential partner. You'll want to go into the first meeting ready to discuss common mission goals. This is only going to work if both sides have a similar cause and interest. What commonalities do you share? How can you angle your mission to meet theirs? Next up, have a purpose for the healthcare professional. What do you need them to do? Be ready to explain their role in the partnership and what will be expected on their end. Ask them how they see themselves fitting into the picture, with the understanding that this is all subject to change as you flesh out the partnership and any related programs in the coming weeks and months. Third, have an honest big picture discussion about the state of things. What do the potential beneficiaries and patients really need? You want to make sure that whatever partnership you're putting together is something that end users are going to want or need, and that it makes sense for the audience. Otherwise, it just won't work, and it'll be a waste of time and resources for both the club and your partner. Consider other factors. Determine what else can impact a beneficiary's needs. What barriers are they facing? How and where do they like to be treated? What education or service gaps are most common? How can you communicate with them? And finally, discuss potential solutions that can help mitigate the major issue or issues you're trying to solve. Brainstorm together to see what both sides can bring to the table. Look at both the club's current work and that of the partner to see if there are any natural correlations. Think about past programs that can be revamped to meet new and existing needs. Examine other offerings in the community to see if you can help fill a gap or to partner with them to expand their reach. An important question we ask ourselves anytime we take on new work or when we reevaluate the work we have been doing is, what does success look like? In researching this topic, I came across a list of components of successful partnerships from the Center for Healthcare Strategies and Nonprofit Finance Fund that can help us begin to answer this question. They have grouped these into 3 key areas: building community ecosystems, managing through partnership evolution, and building the case for partnering. Under the umbrella of building community ecosystems, the Center for Healthcare Strategies and Nonprofit Finance Fund have identified 2 key parts: cultivating existing community capacity and expanded information sharing. Cultivating existing community capacity simply acknowledges the partnership between the club and healthcare provider. It works on the premise that the healthcare provider is known as a trusted resource in their area of expertise and or community. These professionals have the subject knowledge that can be leveraged by the club and accordingly the partnership to better serve the priority population or populations in need. Both sides also bring other existing relationships to the table that may be used to garner additional community support. Expanded information sharing looks at measuring the number of people served and the services used. The Center and Fund note that this data can be used to compel new ways of sharing information about the program with various stakeholders. This could also include things like referral and enrollment rates. Managing through partnership encompasses the next 2 components outlined by the Center and Fund: evaluating partnership processes and outcomes, and the financial cost to partnership. When we're talking about evaluating partnership processes and outcomes, we are talking about the return on investment, or ROI. Demonstrating an ROI is going to be critical to long-term investment, so both sides will need to identify clear, meaningful outcome measures and how those measures will be reported. The Center and Fund emphasize that flexibility and transparency are especially important here. After all, growth is often slow at first, and alterations will need to be made as operations develop over time. This process ensures that you have a way to find and justify such changes. The other is keeping track of financial costs to the partnership. This means expenditures at the outset as well as those that come later like staff time and resource utilization, which can be somewhat harder to measure. The Nonprofit Finance Fund has put together a tool that can help partners articulate their value. You can find this by searching for the Value Proposition Tool on nff.org. Finally, we have the area described by the Center and Fund as building the case for partnering. It includes 4 key components: provider buy-in, business case, mutual benefit, and reducing stigma. Provider buy-in is the case for partnership and support that we talked about earlier in this presentation. It ideally illustrates the value proposition for each partner. The business case takes into account and builds upon ROI. It looks at the quality of life for those served, improved care equity, and any growth toward community or population health goals. The mutual benefits piece looks at the value of achieving mutual goals, the Center and Fund explain. Finally, reducing stigma is the program's impact on the willingness of those in need to pursue your services. Experts note that developing an informed approach and training those involved to be mindful of consumer sensitivities can help remove barriers to getting families the help they need. If your club is looking for places you can find local partners, we have provided a short list of suggestions here. They include practitioners in the field like audiologists, hearing aid specialists, and speech pathologists. There are also educators in local school districts, community college, and university systems. You can reach out to those on the consumer product side by seeking out local hearing instrument retailers. In all these cases, I would encourage you to not overlook other staff in these individual offices. Frontline workers often have great insight into the issues that are out there and the people that they're helping. It also increases your pool for volunteers and thought leaders. The other place you might consider is other speech and hearing nonprofits. Organizations like the American Speech Language Hearing Association, Hearing Loss Association of America, and American Academy of Audiologists have chapters located all over the United States. Sertoma has partnered with these organizations nationally at different times, and many of our members and clubs have found great success in working with them more locally. These organizations' members are the people that you are often trying to reach, so getting in front of them is never a bad idea. We also previously mentioned educational institutions. It was specific to the teachers and professors there, but here we're talking about the institutions themselves. Having that name recognition behind you can be a true game changer. None of us can do what we do on our own. We rely on each other as members of our club to make our work successful, and in turn, our clubs often rely on other partners to help see our mission through. While much of the information here focused very specifically on hearing health, you can take many of the lessons shared and translate them into any other focus. We hope that you will join us in our National Hearing Health mission, but we also encourage you to seek out any partnerships that will make any of your club's efforts more successful. You can find additional information on hearing health on sertoma.org. We also have other resources and trainings available to our members in the Member Center on the site. And as always, don't forget that you can find other members and your headquarters staff in your members-only group on Facebook by using the link on the screen.